Wellington Eye Clinic.
We have been putting smiles on people's faces
for 35 years.
Now we're offering a new procedure called
Smile. So laser eye surgery is where you try and change the power of the eye by means of changing the shape of the cornea using a laser. So it's been going for 25 years, and initially the treatment was done on the surface of the cornea. Why it evolved was there was a longer recovery and there was some discomfort initially. Someone then had the very bright idea of doing the same changes but under the surface, and that's when LASIK was born. So with LASIK, a little flap is created, the flap is moved out of the way, and then laser is done on the underlying tissue, and then the flap is put back in place. Because the flap is untouched, the visual recovery is very fast and you can see tomorrow. Smile is the newest and the latest technique, and that's where you do exactly what you do with LASIK, except you don't create a flap. So now what the laser does is it makes an incision inside the cornea, makes a second incision above that one to create a little lenticle or a lens, and then creates a small little channel through which the lens can be removed. So you're now changing the shape of the cornea in a LASIK fashion, but without creating a LASIK flap. So the best way to describe it is a keyhole LASIK. And by not creating a flap, you cut less nerves, so it may be better for someone who has a dry eye issue. And the second thing is for someone whose corneas are thin, it might leave the eye with a stronger cornea post-operatively. So we think Smile is particularly suitable for people who are doing the bigger corrections. So to figure out whether you're suitable for Smile or not, you need to have a full assessment. We think initially that the person most suitable to Smile are going to be patients who are having larger corrections done that in the past would not have been suitable for LASIK because there's not enough tissue. But Smile is going to allow people with higher corrections to have a procedure where your recovery is quicker than a surface procedure. So mostly the higher corrections, people who are very short-sighted, would be the most likely candidates initially. The key benefits of Smile would be that you still have a quick recovery, you have a stronger cornea post-operatively, and there are less issues with dry eye.